Hi fans, welcome to Get a Link family. Guys, today we are going to talk about prostate cancer. But before we continue, I would like you to follow this page. If today is the first time you come across our page, just follow this page. We are here to teach you something that can help you in life. So today we want to talk about this prostate cancer. You know that prostate cancer is very common in men, and a lot of men are being worried. You know why? Because they don't go for prostate tests. They don't go for PSA tests. That's why they are worried, especially we African men. They don't go for prostate tests. It's not like white men. They normally go for tests whether they are getting symptoms or not. They always go for checkup. They always go for prostate tests. But it's not like that in our men. I don't know why our men are not going for prostate tests. But if you're a man and you are under the sound of my voice, I will advise you go for prostate test. What is prostate cancer? Prostate cancer simply means the abnormal growth of a cell in your prostate gland. Yes, abnormal growth of a cell. Like let's say women that are having fibroid, they normally see abnormal growth in their destiny. Exactly when it comes to men. And this prostate cancer, it can make men to feel worried. And let me shock you, the reason why most of us or most African men don't normally go for prostate test, that is PSA tests, is because they are waiting to see symptoms before they go. But let me tell you this thing, this prostate cancer of a thing, the symptoms don't normally show at the early stage. Yes, you can only detect them when you go for PSA tests. That is the only way you can detect them. But if you are waiting for you to get symptoms before you go and see your doctor, yeah, I'm sorry, you may not get the symptoms, because at the early age, the chances of getting symptoms may not be there. That's why that it's very good as a man. You need to go for PSA tests. PSA test simply means prostate specific antigen. Yes, prostate specific antigen. Are you getting the point now? So you have to go for these tests for them to detect whether you have this prostate cancer or not. Like men from age of 40, 50 and above have the chances of getting this prostate cancer, and that's why that they need to see their doctor. They need to consult their doctor and go for this test that I say PSA test, prostate specific antigen. Yes, so please go for it. Now we are going to talk about the symptoms, what the symptoms look like. Like I said before, that it's very hard for you to see the symptoms at the early age, but when you start seeing this thing, just you have to rush and go and meet your doctor. These symptoms of prostate cancer are times difficult in urinating, yes, or urinating frequently. All the time you urinate, you like to go to washroom, all the time you like to go to washroom. Just